How is Sweden doing during the COVID-19 pandemic? Hi, I'm Dr. Abe, Associate Professor in Nursing at Western University, and here on What the Health, I want to make your healthcare questions clear. So Sweden was big news during the pandemic, especially in the first 6 months, because they really bucked the trend globally in how they were responding to the pandemic at all. So their initial response was very low compared to the rest of the world. So they did move high schools and post-secondary online. They had indoor limits for 50 people. But here in Canada, at that same time, in that first wave of the pandemic, we had closed all schools of all ages. Everyone was working from home, and only the most essential businesses remained open. In other countries, there were things like curfews, and there were geographic travel restrictions, and even some very tight stay-at-home orders. So Sweden's state epidemiologist Anders Tegnell became a very central figure in this approach. He became a bit of an online hero for those who were very much against the restrictions. And Sweden itself was lauded as this potential outlier that was going to prove public health restrictions ultimately as a failure. So it was lauded by those who were skeptical of the pandemic as a whole, who were skeptical of lockdowns, and who really saw prevention as a limit on the ultimate goal of herd immunity. So there were kind of multiple angles by which people were promoting this Swedish response. So they said that, maybe there's more deaths in the short term, but in the long term, through immunity, that Sweden will do better. They argued that maybe we were all overreacting except for Sweden. And there was also this talk about like a cultural factor, which is maybe the Swedish people take greater personal responsibility. So they'll protect themselves better through things like masking and hygiene and distancing. And so they don't need rules like the rest of the world might need. So what did we learn? Well, we've got a year and a half of hindsight now on the Swedish approach, and we can really see how they're doing. And I think this graph tells the story the best. So you can see at the outset that Sweden had this highest cumulative deaths per capita, and comparing against countries which I would call, high, middle, and low COVID-19 responses. Also greater deaths than their neighbor Norway, and really that holds for any countries you want to throw in the mix. Any of their Scandinavian neighbors, any of their European neighbors, apart from some outliers like Russia and Romania. Sweden's just simply had a very high rate of deaths. So as early as April 2020, there started to be questions internally about this Swedish approach, as well as externally. And so some said, let's hold the line. This is the way it's going to go, and it'll be a long-term success. At that time already, we were making progress on vaccine development, and we were pretty much out the gate starting to talk about, we may not actually need natural herd immunity if we can achieve vaccine immunity. And so maybe what we need to do best is protect lives for as long as possible until those vaccines are available. And so with some of this criticism, there were some further restrictions introduced, such as limits around public transportation, greater distancing in restaurants. But the real pivotal moment for Sweden was in December of 2020, when a report came out that basically criticized this as an abject failure, and said that there simply cost a whole lot of lives without a real benefit. And that report led to a public apology from the King of Sweden, from the Prime Minister of Sweden at that time, and subsequently the introduction of a lot of new restrictions in January of 2021, essentially bringing Sweden in line with the rest of the world and with at least Europe. And so things like business curfews, schools going online, external and internal travel restrictions all coming at place. And so by finally putting in those public health restrictions, Sweden was able to flatten that death curve and bring it in line with the rest of Europe and high-income nations. But the toll to get there has been so incredibly high. They've got twice the deaths per capita as we've seen here in Canada. And worse than that, 7 times the deaths per capita compared to places like Finland and Norway, their Scandinavian neighbors. So ultimately, there's been this high preventable death toll with no particular benefits because they ended up with the same restrictions as everyone else anyways. And they're lifting them now in the same timeline that the rest of us are starting to relax the restrictions. So how did Sweden's experiment end up working out? Personally, I would categorize this as an abject failure. In fact, I think it illustrates precisely why we need good public health restrictions in order to beat a pandemic. The most important thing is that we save lives. That's it. That's the number one issue, and Sweden didn't do that. They failed to save lives. They tried something that was different than the best evidence of public health approaches, and it cost them a ton. It looks like somewhere in the realm of 14,000 unnecessary deaths compared to just looking at Finland and Norway death rates. That's a huge number of lives lost unnecessarily. So I would say let's stick to the public health science. Let's prioritize protecting lives. Let's never repeat Sweden's mistakes. And so that's what the health is going on with COVID-19 in Sweden.